Okay, since my patient is going into surgery, I'd ask them how they're feeling, and if they're feeling tense about their upcoming surgery, I would do breathing exercises with them. I'd have them take a deep breath, hold for 3 seconds, and exhale. Deep breath in. Deep breath in. I do that for 5 or 6 times, and then I ask them how they're feeling. So now we're going to go on to surgical asepsis. I have my drape, my sterile drape, sterile bowl, sponges, applicators, sterile water, and my sterile gloves. When I open the drape, I open like this, I pull back, take a corner. The outside edges, 1 inch in, is considered contaminated, so I will hold on to those. I will lay this down and let it fall, and I will demonstrate. Okay, so now I'll just leave it like that, and then when I have my gloves on, I can touch it and it'll be okay. So now I have my bowl. I take the farthest flap, pull it out, take the side flaps, pull them back, and tuck them under my hand that I'm holding them in. And then I will grab the edge with the flap that's closest to me, and I will set it down in the sterile field. So the outside is contaminated, the inside isn't.
I know, so I'm kind of worried. Like, oh, please don't give me an infection.
And it's within the parameter, so it's still in the sterile field. Now I take my sponge, these down, and I want to flip it into the bowl. Take the swabs, pull these down, now I have my sterile water. The outside is contaminated. I'm going to take off the cap, set it upside down outside the field so that the inside doesn't get contaminated. The inside is sterile. I'm going to tilt it about 6 inches above the field at an angle and gently pour, and then I will bring it quickly back to vertical. If the liquid does spill on the field, then it's considered contaminated. I'm going to look at my label, and I'm going to check 3 times. It's sterile water. This is what I need, the expiration date. I'm going to have the label to the palm of the hand. Now I have my sterile gloves.
Are you studying? I'm studying.
Open these, make sure the side flaps are pressed down. I'm going to start with my dominant hand. I'm going to grab onto the cuff that's going to be touching my skin. I'm going to grab onto that with my non-dominant hand and slip them on, making sure my thumb is to the palm. When I have that on, I won't worry about the glove on the wrist. I can adjust those when I get all my gloves on. So then the non-dominant hand, what I'll do with my sterile glove, I'll go into the inside cuff, only touching the outside of the glove. And I will slip that on. And now I can adjust my gloves. Here we go.
First thing we're going to do. Start over.
Yeah.
That's what I have.
Okay, now that I have my gloves on, I want to hold my hands like this so that they stay in the zone of the sterile zone. And now I can move and adjust my work area. Put that in, move the bowl, and do my Q-tips, my swabs. Band.